the number of nearsighted children is soaring, and experts say there may be a number of reasons behind that fact. Some doctors say too much screen time, both at home and school, may be playing a role. So does genetics and increased awareness among parents to have their children's eyes screened. The number of children in the U.S. who need glasses is close to 40% now, and the percentage of kids with nearsightedness is 45%. Experts also say that once kids get corrective lenses, their vision is deteriorating faster and faster. All right, more than 100 million adults in the U.S. are now living with diabetes or prediabetes.
But a new study suggests that the condition is becoming more common in children. Joining us to discuss is Fox 5 medical contributor Dr. Sabrina Fabi. Dr. Fabi, thanks for joining us. What is prediabetes and what is the cause for most people who don't know?
Classically, we used to consider two types of diabetes. Type 1, which is something that was generally genetic, came on as a child, and that's when your pancreas cannot secrete or is not secreting enough insulin. And type 2 diabetes was typically more of an adult-onset diabetes that we saw when people, their cells were no longer responding to the insulin that was being secreted, maybe because too much was being secreted because they ate a lot of sugary meals or because they started to become more obese and those cells were no longer responding. Now we're starting to see that this is trending towards a younger demographic, and so it's no longer adult onset. We're starting to see it a lot in those that are even in adolescence. And so we're seeing that before you actually get full-blown type 2 diabetes, you can go through a stage called prediabetes, which puts you at risk. You're basically almost going to get there, and there are warning signs that people can basically test for.
And so what do we need to know? What's been changing in our culture, and what's the cause of that number? 100 million, that's a staggering number.
That's a staggering number, and what we know is that it's actually the incidence of diabetes globally. Adult onset diabetes has doubled in number globally since 2004.
Is it the food we're eating?
Perhaps, because what we're also seeing is a correlation directly with an increase in obesity. What is so alarming is that 20% of adolescents are obese. It's not just overweight, it's a BMI of greater than 30. And a third of young adults are obese. And so we're seeing that those numbers correlate specifically with developing type 2 diabetes.
Well, inactivity, diet, those kinds of things, what can we do to prevent it?
Right, and so perhaps, yes, what are we seeing? Fast food, right? So trying to minimize drinks that have added sugar to them, extra large drinks that have sugar added to them, fried foods, a lot of carbs like French fries, potato chips, although they taste so good, it's probably not necessarily the best for us, right? Because it's increasing our size, yes, but also putting us at risk for type 2 diabetes, which then puts us at risk to what you were talking about, blurred vision. You can actually have eye changes from having diabetes, so maybe there is a correlation there from what you just covered. You can also have increased urination is another symptom, a lot of fatigue or tiredness, which would add to the inactivity. And so these are all perhaps symptoms that someone may start to notice, or even weight change when you start to have type 2 diabetes.
So what happens when somebody gets into that pre-diabetic category? Is there something they can do immediately to say, all right, let's go the other direction?
Yes, so if you start having any of these changes, first getting checked out to see if you perhaps have it, and that would be diagnosed with a blood sugar level. If you have two that are abnormal, then they're gonna have to watch you a little bit more carefully, and you should be monitored every year to make sure that you're not falling into type 2 diabetes. What also puts you at risk if a family member has a history of type 2 diabetes, if you're African American, Asian, or Hispanic, those demographics for whatever reason are at increased risk. So that's another risk factor. So if you have one of those two risk factors plus an abnormal hemoglobin A1C or blood sugar level, then it's something that you need to be monitored very closely for, because what the long-term problem with this is that you can eventually have cardiovascular disease, stroke, heart attacks, blurred vision, even amputations from the inability to heal properly. And from a greater perspective, what we actually saw is in 2010, our life expectancy finally plateaued. And in 2014, we started to see a decrease in life expectancy. So much so that we know that just obesity alone will and having type 2 diabetes will decrease your life expectancy by 15 years.
Important information.
Yeah, pretty
Eat
incredible.
well, take care of yourself, be healthy.
Yes.
All right, Dr. Sabrina Fabi, thank you so much.
Thanks for having me, guys.